Today, the tables are turned as Dr. Judith Borger interviews me about my journey in writing and creating Medspa Mayhem for her podcast, The Aesthetic Doctor. I hope you enjoy this conversation with Dr. Borger, and I will be back next week for season 2 with video content. This is Medspa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry.
Hello, friends. This is Dr. Borger, and welcome to episode 65 of the Aesthetic Doctor podcast. Today, my guest is none other than Dr. Kate D from Glow Medspa in Seattle. Dr. D is a recently published author. Her book, Medspa Mayhem, is exactly about that. It talks about the good, the bad, and the ugly within the aesthetics industry. It was recently released in June of 2024 and is sure to not only become a bestseller, but really be eye-opening for all of you that read it, and I really hope you will read it. It's a great book. It really sort of pulls the curtain back on everything in the med spa industry, and it talks about the behind-the-scenes stuff that I think a lot of consumers are unaware of, the unlicensed institutions, the complications we've been reading about in the media and how they were about to happen, the patients, the reps, the procedures, all of it written from 10 years of experience that Dr. Kate D has within the med spa industry. Dr. D practices and owns Glow Medspa in Seattle, Washington. So please enjoy my conversation with Dr. Kate D, med spa owner, aesthetic medicine physician, and published author of the book Medspa Mayhem. So, friends, like I said in my intro, I am so excited to have Dr. D here, and she recently released her first book called Medspa Mayhem, which is what this podcast episode is really all about. And the reason I love the book is that it's an insider's guide to the aesthetics industry. So if you're one of our listeners, you know you're interested in that stuff, chances are you might be getting those procedures. And this is really the curtain pulled back. Like Dr. D says, it's the good, the bad, the ugly, the shocking, the reassuring, all of it. So welcome, and thank you for being here.
Well, thanks so much for having me. That was a really great introduction. Appreciate that.
Yeah, so I mean, let's go all the way sort of back to the idea. Medspa Mayhem, the book is called. It released on June 11th. So by the time this episode comes out, it'll be recently released. And I was able to get an early copy so that when we have this interview, I have really read the whole thing cover to cover. I was fascinated by it, but what made you sort of write the book?
Well, so a lot of that story is in the book itself, but basically I got into aesthetics really serendipitously. I fell into it and I loved it, and it's been really a great journey for me. And I went from being an expert in one thing to being a novice 10 years ago. And I just, oh my God, I have to be an expert in this new thing that I'm doing. And it was a really big deal to me. And I learned a ton of my skills, my knowledge, and also about the law, about aesthetics. And as I went forward, I was kind of dumbfounded by how many people were in the industry who were completely untrained or working completely illegally, having some egregious complication. Like you and I kind of met through a group of physicians who do what we do. And so many physicians in the industry kind of throw up their hands or like, isn't this crazy? Like, why are all these people doing this illegally? It's so dangerous. And like, they don't realize how dangerous this is. And had to write about it. I mean, we do live in this kind of crazy world, right? Where for as many people who are very passionate about doing it the right way, there are just as many who are out there ordering illegal hyaluron pens off of Alibaba and then making money by really risking other people's faces totally off the grid, off the, illegally. So I just started writing about it and all the stories, how I got to where I am and all the experiences I've had. And I just finally, I think around my birthday of last year, 23, I was like, this is the year I get this thing published. So that took well over a year to make that happen. So it's finally here. I'm really excited about it. And my real goal is just to educate the public so they know what questions to ask, how to figure out who's legit, who knows what they're doing, who's doing it right, and who's completely cutting corners and doing dangerous things. My goal is to put that information in consumers' laps and they can run with it whichever direction they want.
Yeah. And, of course, like I loved really that personal aspect too about the book. And for those of you, I'm assuming when people listen to this podcast, it's going to be the introduction to the book and they're going to go out and get it. So, yeah, I do love that. I felt like I got to know you and your journey through the book as well, sort of how you got into it from being a breast radiologist and doing all the imaging to really, I love that section 2 where you're kind of talking about how you actually asked your group if they would help you transition and help you open up a spa, and you got laughed at. And now
Yeah.
see, here you are. And after 10 years in the industry, and like you said, I think the only time we've actually met in person was at AmpSpa in 2020. I had talked to you on the phone, and you actually gave me some great advice when I first started out about skin type solutions and some devices. So I appreciate that. But I think the only time we've ever met in person has been at AmpSpa 2020. And you and I are both passionate about the legality of things. So not only do you go into your journey, but I do really love the emphasis on what is legal, what is not legal, and also how do people like try to get away really with what's not legal.
Well, I'm surprised at how many people just have no idea that the place they've been to was functioning illegally. Even I had a patient a few weeks ago who's a lawyer who was first time she's coming in to see me and she had had Botox at this other place. I was like, "Oh, what kind of place did you go to?" And she's like, "Well, there's this girl down the street from my office." And I'm like, "Well, a girl? Was it a nurse?" Like and this lawyer who was very smart had no idea who this person was or what her credentials were, what was it illegal, probably not. I think that if you're smart, it doesn't necessarily mean that you know the law. Even lawyers don't know what the law is. So I think that it's really critically important to get that information out to patients because I've also, on my podcast, I've had interviews with a couple of people who've had very, very devastating outcomes from the treatments they've had from, well, one very horrendous outcome was from at a completely illegal, unlicensed person in California. And this woman almost died from that treatment. And she just had no idea that this place was operating illegally. It looks nice, it's clean, it looks beautiful. People are wearing scrubs. They just assume that there's proper licensing, which there isn't. And unlike cosmetology licenses. So, for instance, if you cut hair or if you do waxing, you have to have a cosmetology license, and the cosmetology board will actually come and inspect your place. Sometimes, frequently, depends on where you are. But for us, like we have medical degrees, we can practice medicine. Nobody comes checks on us. And if someone else is practicing medicine illegally, nobody's checking on them. So they can be completely illegal and there's no inspection at all. So
You're absolutely right that you say that because my esthetician wants to also start doing lashes. And initially I was like, oh, I don't know if I want to become a lash place, but I love her and it was the thing she wanted to do. But it is so funny that that is the time where we had to like go get at the check sheet for the board of like cosmetology for the state to get like inspected for the lashes. And you're absolutely
Yeah.
right, for
And
the
and
like 5 or 6 or whatever years before that, like nobody cared.
nobody cares. And you can have lashes and waxing and little wooden sticks in one room, and they will come and inspect everything. You can have lasers and other things that can do harm, like bloodborne pathogen type PRP and stuff. Nobody comes and inspects that. Now, how crazy is that? Right. So I think that if people knew the state of affairs in this, they would absolutely ask those questions themselves if they knew that nobody else was asking and nobody was really policing this stuff.
And I really love how in the book you really urge the consumer to do that, because I think those are the takeaways for the reader from the book. Not only like you share, and I just want to tell people it's a really well written book. Like as I said, there's multiple sections. Dr. D talks about how she got into it, also sort of what are some of the challenges, both in terms of patients that she's had, in giving real life examples from her history, from cases that were in the media, and explains what happens. And then also talks about employees, common procedures, all of the things. But I think one of the things that I love is that you really use those real life examples that you've had them in your spa, but I think any of us who've treated enough patients, heard enough stuff in the industry, have had similar examples. And like you said, give the patients the tools and the takeaways as to like what to ask about the credentials, about the training, about the outcomes.
Absolutely. I think that it's really interesting because you and I are both physicians. We both took the Hippocratic oath. Number one thing is do no harm, right? And we have licenses that we need to maintain. And neither of us wants to have that threatened in any kind of way, right? So physicians tend to operate by the book 100%, right? We are super anal people. We went to school for a really, really long time for this. And so we know all the ins and outs and facial anatomy and all the good and very bad things that can happen. So we're really anal about what we do, right? But if you don't have that education and you don't know the bad things that can happen, everything's fine until something awful happens, right? And they have no idea that it could come because they don't know that's a possibility. And so I just was interviewing another esthetician actually for the podcast yesterday. It's not up yet, but maybe it will be by the time this airs for you. But she was saying that she teaches in an esthetician school and has students who are practicing illegally already and ordering hyaluron pens online and offering needleless lip filler. And they have no idea the depths of the danger of that. And they could permanently disfigure somebody and they just have no idea. And so if you think, oh, I've got a great business idea and you don't know what you don't know, then you don't know that you could potentially really, really harm someone. And this stuff is just going crazy because the industry is exploding. People keep asking me this, and I don't have hard numbers, but my estimate is well over half of the growth of the industry since I've been in it the last 10 years has been people entering into it illegally.
Well, so I want to make 2 points. So you've now brought up hyaluron pens twice, and I just wanted to say that I've actually had an episode about that too. Hyaluron pens are bad and why they're bad. It's like one of my, I don't know which episode it is, but if you're interested and you want to learn more about it, because yes, hyaluron pens are bad. But again, they like the same thing. They sell it as if it's the same lip filler as like lip
Yeah.
filler, and it's completely different in all the ways, but I don't want to focus on that. And number two, I completely agree. When I think about my town, right? And the Medspa industry is popping up everywhere. I think ever since I've opened, everything else that has opened is not owned by a physician.
Hmm.
Like it's very much CNAs and we nurse practitioners, people that I don't even know what their credentials are, because nowhere on their website can you actually find
Right.
who injects or who owns in their, but like you said, beautiful med spa owned by somebody who's totally non-medical, and you can never find who actually owns or who injects. And you're absolutely right. In our state, that is absolutely not allowed because physicians are supposed to be the only owners, even though there's, of course, ways around it that you illustrate how it can be done legally or pseudo-legally. And two, you and I, how many times do you get approached to be somebody's medical director? I mean, I
Yeah.
say no to that. No, 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 no. And I urge every other physician, unless they're going to be injecting, training, really being on site, overseeing, leading the practice, providing all of the right things, to not fall into that trap. But again, I mean, I'm sure if you wanted to do that, you could be overseeing 40 spas by now.
Yeah, and that is unfortunately really common, that there are some physicians who have no ethics who are willing to rent out their medical license for a fee. They don't actually know anything about aesthetics. They don't actually perform it themselves. They don't actually oversee the practice of these other people. They're just taking the money and giving their license out in order for that person to practice, buy the Botox, buy the lasers, blah, blah, blah. And so those unsavory characters who are MDs or DOs and they're renting out those people, I just feel that makes me super angry. Most of us in the business would never dream of doing something like that. And we know the risks and it's just completely unethical. But also, if any of those people does anything wrong, it's your license on the line, not theirs. Even in RN, like if an RN is doing this on their own, the insurance is the doctor, not the RN. The malpractice, if there is any case, is against the doctor, not the RN. Nothing really happens to the RN. And so they can just find another bozo to rent out their license and keep going, even if they have bad outcomes themselves. So I really think that people need to understand how this works, because just because it looks legit, absolutely does not mean that it is.
And unfortunately, I think, like you said, and I do this a lot, like so many times I actually steer patients away from, even if they come in and they're willing to buy like this huge package of laser X, right? And I say, you know what, for your skin types and for the outcomes you want, let's just try like the melasma peel, because this isn't
Hmm.
safe and this and that. And you know what, it's only $500 and you were coming in willing to spend like 3,000, and that gets you patients for life. But honestly, like when we really look down to it, unfortunately, a lot of the corruption in the industry, it's all about greed, right? Because it's
Yeah.
a billion-dollar industry.
Well, it's actually $100 billion industry if you can include cosmetic surgery. And I do talk about that in the book as well, because a lot of these places incentivize their injectors to just do more. And if you come in and you're willing to spend $3,000 that day, they will make sure you spend $3,000 that day, whether you need it or not. And I am 100% with you. Like, I talk people out of things all the time. If it's just not the right thing for them, I would never recommend it. And it's the only way I can be, and the only way that I can have my practice function. So all my people, a staff of 10 of us, but we never ever recommend something that's not necessary and or just doesn't make any sense. But we've had patients go to other places where they maybe wanted one syringe of filler or something, and they get talked into 4 or 5, and then they look ridiculous. But that injector makes 4 or 5 times as much money if they inject 4 or 5 times as much filler. And that's what happens. It's really, really common.
Yeah, and you definitely talk about those examples and some of the big chains and things like that as well. So you said earlier you want to change the industry. Tell me what you mean
I
by
could
that.
try. Well, I'm starting with just educating the public. So the more everybody knows, just as you're doing, the better off everyone will be. And if the questions to ask and those places that are illegal are visible now, there's a way of telling, then hopefully very few people will continue to go to those places. There will always be people who are willing to go to the illegal cheap place, or they'll fly to Mexico to have a surgery that would be 10 times as expensive in the US. There's always going to be some people like that. And I'm not looking to try to eradicate all medical crime here. But I'm really hoping that I truly believe that the vast majority of consumers in the aesthetic space really do care about all this stuff and they really do. They would not take that risk if they knew about it. I can't tell you how many people walk into my place and they've had filler elsewhere and never heard of a vascular occlusion and never dreamed that that was possible. The woman I interview on my podcast, that one was called Disfigured Beauty, but she had been getting filler for years and had no idea that vascular occlusion was a risk. And she is now scarred all up and down her whole face and lost half her nose. Okay. And if you knew that were a possibility, you wouldn't have a non dissolvable filler injected in you. You just wouldn't do it at all. So anyway, how am I going to change the industry? So one, hopefully educate consumers. Number one. I'm really hoping that between the book and the podcast and people like you that we capture the attention of a politician or an attorney general or a documentary filmmaker or I really do think that we can change this because there is regulation in other areas. So if someone can come along and inspect your facial room, someone can come along and inspect everything else and check the credentials of the people providing the services. I think that's the most important thing is that do you have a license to do what you are doing? And I would anybody going to their favorite place, wherever it is, you probably know, but just ask them, like, what's your credential? And who owns this place? And who's the medical director? If you're seeing an RN, that's fine. They're allowed to inject Botox, but like, who's the doctor who's overseeing you? I mean, there has to
And
be
are they
one.
actually nearby, right? Do they
Right.
actually ever step foot in the spa
They
and,
actually have to be there
inject
and
the
to
tox? Like, it
actually
is funny
oversee
because
you.
sometimes when people come to my place, they're actually surprised that they get to see the doctor.
Right. Well, the lady who died last summer in Texas, that doctor was not overseeing that place. The person had no license to practice medicine, and the doctor was 106 miles away from that spa. And they were skipping every possible step, including the good faith exam. And this lady died. And the person who killed her probably was horrified, but she had no idea that hanging some things into and putting it into someone's vein could kill them. I mean, that's the craziest thing is how could you not know that? It's just mind-blowing to me.
And you go over really also in one of the earlier sections of the book, really the difference between the levels of training. And it's another thing too, in terms of the doctor thing. Also, is your doctor a medical doctor? Because certain nurse practitioners now that get a doctorate of nursing practice, which is a very
Well,
different
they
threat,
are
come in and
actually
say, I'm Dr. So-and-so,
and
when
that's not
really,
legal. And that's actually not legal for them to say that they're doctors. And some states will actually come down very hard on those people and give them a cease and desist. If nurse practitioners have the word medical in their name or the name of their place, if they call themselves doctors, so misleading patients by nurse practitioners saying that they are doctors is not okay. It's really interesting too, because I was at the last AM Spa meeting and the lawyers there were very heavily stressing the fact that nurse practitioners don't practice medicine. And I'm like, huh, okay. But they practice nursing. So the nursing board controls RNs who are regular nurses and nurse practitioners who are mid-level providers. They usually have a master's. They can go on to get a doctorate in nursing, but that's still practicing nursing. Whereas MDs and PAs are practicing medicine. The medical board controls doctors and PAs. And so PAs also generally have a master's. They're kind of mid-level education. And there is this dividing line between nursing and medicine. And I actually didn't know, but legally that the nurses cannot pretend that they're practicing medicine.
oh, that's so interesting. Well, even like a PA next close to me who is a very, very nice person, but also got a doctorate in who knows what and goes by doctor so and so now. And I can tell you it isn't an MD. So,
And you know
it is,
what? Lawyers all have a degree called Juris Doctor, but they don't call themselves doctors.
neither
And
do the pharmacists, right, in the
PhD,
hospital.
they don't. And PhDs who have a doctorate in economics, they're also doctors, but they don't go by doctor. I mean, I think that when you are pretending to practice medicine is where it's a problem. Obviously, if you're practicing law, everyone knows you're not a doctor. But when you're in the medical space, then it's very confusing. And then that is kind of a violation. It's basically considered false advertising by the prosecutors. Not that the prosecutors necessarily are going to pursue that. One thing I've learned a lot over the last couple months is that there are heinous crimes committed every day in the United States that are never prosecuted. We know who they are, we know what they did. Prosecutors just don't choose to prosecute. And not to get political, but that's what the last two big national cases have happened, right? Both of those individuals wouldn't have been prosecuted had they not been who they were, apparently. But that's what happens is DAs have to prosecute. So the case in California where this girl was almost killed, she was injected all over her body with a fake Kybella that was contaminated. She got a rip-roaring infection. She was in the hospital for over 3 months. She was almost killed. This person was unlicensed. That DA chose not to prosecute that person. Even though it's like a felony and she almost killed somebody, she was never prosecuted. I think for consumers to protect themselves, they can't assume that threat of prosecution, that person doing the illegal thing, will keep them from doing it. It won't. You need to ask right before you go.
And that's another point that I want to bring up for our consumers that are listening. A lot of times when I read the news reports that has happened over the years, right, where and you bring up some of those cases in the book. Of course, there's way too many than what we could ever describe in a book, but you do a nice job illustrating some of the cases. But when people contract HIV and things, and I actually educate my patients about that too. And I'm like, okay, and look, on everything, there is a risk of infection. However, we mitigate that by using sterile single-use syringes. Everything comes as licensed product. I wear gloves, I disinfect, and I have this little spiel that I go through. But when you and I read those news reports, and I think I would urge the consumers also to go beyond the headline, because it is almost always some illegal product at an illegal place with a person that doesn't have the license. You're going to go in the back room of a hotel or a nail salon to get your liposuction. Unfortunately,
Ew.
that is where stuff is going to go wrong, right? And a lot
Yeah.
of the cases when you and I read them, like the violations and like we said, the sort of egregiousness of it, the carelessness is sort of stunning and shocking. So I really love that you highlighted some of those cases in your book.
Yeah, I think that it's stunning and shocking to us because we know how egregious and scary and risky that is.
Mhm.
But if you don't know, then you can't even imagine the bad thing that might happen because it looks like a legitimate business. Although I'm saying liposuction in the back of a nail salon, I would say no, that looks pretty skeevy. But a lot of these places look totally legit. They look lovely. And in fact, there nothing about it is legit. And I think that going back to why am I doing this and why am I talking about this? We have been for years just sort of dumbfounded by how bad it is and how it's getting worse and how more and more and more people, the more money is in the industry, the more the industry grows, the more people are jumping in completely unlicensed, completely unprepared, cutting corners that really absolutely cannot be cut. And they are providing the service for much less money because it doesn't cost them as much. And if you like, for instance, PRP, I use a pretty expensive PRP kit and it's sterile and it's FDA approved and blah, blah, blah. But you can do a DIY PRP kit and is it sterile? And is it being done properly? And is it done the same every time? And is the quality of the PRP? There's no way to know because it hasn't been tested. To get your PRP kit approved by the FDA or whatever, you have to analyze the PRP. You have to know that it works every time, that it's consistent, that it's the same thing, that it's sterile, blah, blah, blah. And it's way cheaper to use 75-cent tube or whatever than whatever $180 one. I mean, and so, well, I've had people, especially early on, our price for PRP is whatever. And like, well, this place down the street is half that price or a third that price. And I'm like, well, if they're really doing it legitimately, then that's an amazing price. I can't argue with that. Right. But I know much better now. And I know the chances of them doing that legitimately for that price are like zero. Okay. It
Well,
just
that's
is.
That's exactly what we do too. I mean, we might be using the same company. We don't want to endorse companies, but we do the same thing. We have the sterile kits. We undo every time. It's a full kit. It's single use, it's sterile. And you're absolutely right.
Right.
For the cost of the kit, once you then pay your staff and your time and all of the stuff, and you make that example too about Groupon filler or the Groupon Botox. I have a Groupon Botox place near me, and I can absolutely, and I love that you use that example in the book because I felt so seen that I was like, there is no way that, and they're only Medspa, so it's not like a plastic surgery practice that would make where it would make sense to make it a loss leader, because you're like, well, if I can get people in for Botox and sell them boobs, maybe it's worth it to give them Botox and lose money on it. But if you're just a med spa, it doesn't make any sense, right? And I want
Yeah,
to be
no,
the
it's
same
not
thing. I was like,
possible.
you cannot buy, sell, inject $7 Botox
Not
all the
possible.
time. And that's what
No.
I want to try to tell people. Like, I cannot buy it and the syringes for that money, much less keep my doors open, pay my insurance, pay my staff,
Oh,
or any.
you wouldn't. I mean, no, it's not possible. And even the other FDA approved toxins in the US, those are too expensive as well. The only way, if you're consistently doing that, would be to get illegal Botox somewhere. There's no way. And because Groupon takes 50% of the total that you pay. So of that $7, Groupon's taking 350. And Botox itself costs twice that to buy. So there's no way. And so you absolutely risk your health. I mean, we've seen over the last few months, as far as I know, it's 22 people have gotten botulism from fake Botox that we know about.
Right.
My guess is that there's just tons more. It finally got caught because some very astute ER doc somewhere connected the fact that the person had Botox and then had this sort of classic botulism presentation. Botulism, we just don't see in this country very much ever because our food is very safe, our canning techniques are very safe. I think so. The fact that an ER doc not only figured it out and then also reported it, and then the subsequent investigation found it was like at least 11 different states had this fake Botox being used. And I have no doubt that it's every single state. We just haven't found those people
And
yet
I'm sure, again, you and I get approached all the time by manufacturers from China and Russia and all the time
all the
saying,
time,
buy our products cheaper.
right?
And I go, no, 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 that's not FDA approved. But they even say, well, it's the same thing. It's cleared, it's approved. And even in the groups that we're in, right? Those questions come up like every
All the
other
time. Well,
week.
new people enter into the industry and they don't know. And it looks legitimate. There are some companies that import real Botox from foreign countries, which is also not legal for importation reasons. Though the problem with that is, let's say you get real Botox from Europe, say, right? The expiration dates and the lot numbers and whatever, that those are all different. If anything is wrong with any of those, you won't get any support from the manufacturer, Allergan. A while back, I interviewed one of my PAs who used to work in Texas, and the spa that she was working at was illegally getting Botox from another spa that was illegally importing it from Europe. And when they had issues with that Botox and it wasn't working right, they couldn't go to Allergan and say, hey, the vial's not any good, replace it, because it wasn't legitimately purchased. Right. And so they had 100 vials, I think, sitting around, and she was being forced to use them, even though she knew they weren't good, because they had spent all this money on it and had to use them, right? That's where I think people don't necessarily realize that business, okay? So when you're making a business decision, that's not necessarily a really good medical decision,
Mhm.
right? And in medicine, we are so used to not ever, ever having like a financial consideration affect what we think should happen, right? And I feel that very, very strongly in aesthetics. So aesthetics is completely optional.
Mhm.
Aesthetics is elective and beautiful and can really help people out, but it's optional. Okay.
Right.
And I think that nothing in aesthetics is worth any risk, any harm. They're minor risks, but like we just don't take major risks with people. It's just not worth it. Right. There are so many people who are making business decisions, not medical decisions. So if you know you've got a whole case of Botox and it's maybe a bad batch, but the business person is like, well, you got to use that because we paid for it. We have to get our money out of that. We can't just write that off. And it was a bad medical decision to buy it illegally in the first place, a bad business decision and medical decision. But you can't make harm people or make people suffer because of business reasons. I think that that's completely unethical.
Yeah, I could not agree more. So, listeners, definitely go out and purchase the book. I mean, it is chock full of stories, and Dr. D really does, as I said, does a nice job going through section by sections, really all the players in the industry, from the owners to the injectors to the patients to the device companies to the lenders. And I think it will really just be eye-opening to the consumers to read the book, and very informative. And not only are you really going to see what happens behind the curtain, but also really you're going to educate yourself about how to get your own procedures done safely and how to protect your own health. Because, like you said, most of us knowingly, when our health, our face, and body is concerned, we would want to make the best and the safest decisions for ourselves and our loved ones. So the book is called Medspa Mayhem. It is on all major retailers. Amazon is obviously the easiest one. There is a direct link to purchase in the show notes of my podcast. And then Dr. D also has a podcast of the same name. It's called Medspa Mayhem. And tell our listeners what you talk about on your podcast.
Well, basically all the good, the bad, and the ugly. So, not necessarily what's in the book. I have interviewed those two women I've mentioned who've had horrific outcomes. I've interviewed doctors like yourself who are in the industry, PAs. I've interviewed estheticians. I have an interview of like an ER doc who sees med spa complications walk into her ER, and really just talking about our favorite procedures, what's great about them, what the dangers are, what to look for, what to ask for, what works, what doesn't work, what are the risks, and some of these kind of scary stories. So the whole thing's not all scary, I promise, but it's stuff that's really compelling. I did one whole episode on vaginal rejuvenation, for example, like the story of it and everything. And at the end of that, I had several people call me up and say, "I just listened to that episode. I think I need that." It was
And you
really
were like,
pretty
as I
funny.
go into in the book, unfortunately.
But yeah, so it's just really interesting. It's kind of everything about the industry and just trying to get all this information out to people in ways that is entertaining and funny, but also really educational.
So where do you see the industry and aesthetics heading?
Well, I'm hoping, but I think there's going to be a reckoning. I think that case in the death in Texas has really shaken things up there. And Texas was sort of the biggest Wild West state that so much has been going on there that's illegal and just kind of out there. And from my understanding, that has really captured people's attention in Texas in particular and in the industry as a whole. And I think there's going to be a reckoning. I think there's going to be a wave of more regulation of some kind or other. And I was hoping that AmSpa, years ago, AmSpa started to try to put together some standards that we could all agree on. They assembled a bunch of stakeholders and assembled a bunch of recommendations like this is the standard safe way to run a med spa. And there was a huge revolt in AmSpa. The people who are doing it illegally were like, we don't want to change. And AmSpa, I think, lost a bunch of members at the time, and it went nowhere in the Texas legislature. That was the first place they started with Texas, and this was, of course, before the death at the Medspa last summer. But I was sort of hoping it would be them and that would be successful. But it turns out that I don't think that people are policing. We're not self policing. So I think enough of these awful outcomes have happened that it will capture the attention and there'll either be federal or state regulation changes. I personally think there should be a more uniform guideline so that everybody practices the same way. Right now, if you do one thing in one state and you move it to another state, that thing might be completely illegal now in your new state. And I think that's really problematic. I don't think that anyone who's not a nurse or above should be injecting anything in
I
anybody.
completely agree. I completely agree. Yeah.
Uh, so I do think it's going to change. But unfortunately, it's taken botulism, HIV, and IV bar deaths to make that happen.
Well, I love that there's people like you, and I guess also myself with providing the information out there. And again, we vote with our wallets, right? Like that's the other thing. Yes, there's definitely changes needed at the big legislative level. However, consumers also vote with their wallets, right? And if we
100%.
educate
And that's,
consumers and
yeah.
they're now able to distinguish where they want to go and what's safe and what's not safe. Hopefully, there's going to be consumer pressure as well.
I totally agree with you. And that is exactly why I'm talking to you, why I'm talking on my own podcast, and why I wrote the book is give people the information and then they will vote with their time, money, and spending.
So there's two questions I ask everybody on my podcast who's a provider, who owns a spa, who's a physician like yourself. So what is your favorite procedure to perform in the aesthetic industry?
To perform or to have done to me?
But that's the second question.
That's the second
What is
one.
the
Okay.
favorite one to get and the favorite one to perform?
And we're not counting consultations because honestly, my favorite part of everything I do are consultations where I'm just educating people about what's going on with their skin and what my basic recommendations are. But to perform, I would say that's funny. I would say probably Botox because it's so, fun, quick, easy, so satisfying. And I would say the second question, what do I like to receive besides Botox? I actually do Dysport for me, but it's probably Genius. So we do RF microneedling plus non-ablative laser resurfacing immediately after that. And I'm 56 years old. And at least according to my 19-year-old daughter, I look like 42. So
Yeah,
that's my
you definitely do not look 50 something. And the fact that you're here also with no makeup straight out the
I have no well,
shower, I
I
love
don't
it.
wear yeah, I don't wear makeup. I don't do anything. I have no filler in my face. I really just take really good care of my skin. And so I really do think, I mean, we have a brand, I guess doesn't matter, but RF microneedling and non-ablative laser resurfacing, which is very, very safe. I did probably 5 of those the year I turned 50, and then I do about 1 every 6 months ish. And yeah, it makes a humongous difference. So that's my number one for sure.
Yeah, I recorded a radio frequency microneedling episode 2, and I called it the it girl of aesthetics, like the Taylor Swift of the now, because I
Hmm.
feel like that is like radio frequency microneedling. Like everybody needs a little collagen, a little everywhere,
A
right?
lot of collagen. Yes. I think
Love.
it's huge. And I did a little video like before, during, and after, and like the next day that's on my spa website. And that was really, really fun to do. And it's cool to like show people because they're like, oh, well, you're doing this. Okay. You're how old? Okay. Well, let's sign me up. So it is a little bit effective marketing too when it's just my skin and nothing else. And that's what they can see. But yeah, I'm a big believer in RF microneedling.
Well, thank you so much for being on here, sharing your time, and also really sharing your expertise, not only with me and my listeners, but also really with the world in the book by spreading the knowledge. So I'm going to give you the rest of the forum to really just tell people where they can find you, other things that you're doing, that you're putting out there for
Okay,
everybody.
great. Yeah. Well, I don't know if you mentioned, but I am in Seattle and we have two locations here. So West Seattle and Kirkland. And we pretty much do everything. It's called Glow Medspa. And the book, again, is called Medspa Mayhem. The podcast, same name. And I'm really out there trying to do kind of as much speaking as possible. If anybody has a local bookstore where they live and want to do an event, I'll come visit you. And then also, I'm sure you do this in your podcast as well, but if people are really interested in sharing their story or hearing a discussion of their story or something they're really interested in, they can submit that to either a voice recording or an email. So the website is medspammayhem.com or drkatedee.com. So it's drkatedee.com. And if you send an email or voice recording to info@drkatedee.com, I will absolutely get that. And that would be great. I would love to hear from your listeners, especially if anybody has any story they're really interested in sharing or a topic that they really are curious about.
Well, thank you so much. And we are going to put all of that in the show notes. So if you're driving, please do not stop to write all of this down. It will all be in the show notes with clickable links. I hope you go out to buy the book because not only is it really informative, but it's incredibly well written. I took the pre-copy on my cruise and it's so fun. It's digestible. It really makes the points through stories and storytelling. So again, thank you so much for writing the book. Thank you for being here, Dr. D.
Well, thank you so much for your kind words and thanks for having me. If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website medspammayhem.com. And read the book. Medspa Mayhem is available everywhere books are sold. Thanks for listening. This has been Medspa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. Medspa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspammayhem.com.